Hi, my name's Arlene. I'm an assistant practitioner with the Dietetic Health Promotion team, and that's within NHS Ayrshire and Arran. Thanks for joining me today for part 2 of our Messy Munch and Weaning series, and today I'd like to have a chat to you about how to get weaning off to the best start now that your baby's shown the signs that they're ready for solid food. What equipment do you need to get started? Well, the main equipment that you will require to wean your baby are things like a bib for your baby and maybe a covering for the floor, especially if it's not a washable surface. Eating is a lot of fun and your baby will learn that too, but it can be a really messy business. A high chair, that will ensure that your baby's sitting in a well-supported upright position, therefore giving them a good passageway for their food, and that will reduce the risk of choking. Using small plastic feeding bowls with soft weaning spoons, these are best as these are gentler on your baby's gums. A free flow cup, that will teach your baby how to sip and also is healthier for their gums and teeth. If you've waited for the right signs that your baby is ready to wean, then you don't need to buy any fancy equipment to blend or puree. Simply a fork and a bowl to finely mash is sufficient. Ice cube trays and small storage pots, these can be helpful if you're batch cooking and you want to freeze, or also small storage pots for taking food out in your changing bag with you. Babies and young children are especially vulnerable to the bacteria that can cause food poisoning. Here are some helpful tips to help reduce the risk to your baby. Always wash your hands well before preparing your baby's food and check that your baby's hands are clean before feeding too. Keep surfaces clean and prevent pets from coming near food or surfaces where food is being prepared. And thoroughly wash all bowls and spoons for feeding in hot soapy water. Wash all fruits and vegetables thoroughly before use, and this includes pre-packed items. Make sure all meat is properly cooked, and this is especially important for chicken and minced meat. Don't use food that is past its use-by date. Follow the instructions given on the labels. Food that you have prepared should be kept in a fridge and eaten within 2 days. Stir and test heated food before giving it to your baby. Defrost frozen food thoroughly before reheating and do not refreeze any leftover food. Most foods are suitable to be introduced to your baby from the age of 6 months, but there are just a few things to be aware of. So things like dairy foods, like milk, cheese, yoghurt and fromage frais, these should all be pasteurised. Cow's milk is suitable to use in cooking or to add to your baby's food, but not as the main drink until they're after over a year old. Check that eggs have the British Line stamp on them. That means that they're safe to be eaten lightly cooked. That means with a runny yolk. So for other eggs, and that includes non-hen eggs, the yolk and the white of eggs should be firm when eaten. For healthy teeth, avoid adding sugar to any of your baby's food or giving them any foods or drinks that are high in sugar. Best drinks for young children and babies are water and milk. Don't add salt to food as this isn't good for your baby's kidneys. Babies can have nuts, but these should be ground or in a nut butter, for instance peanut butter, and whole nuts shouldn't be given to children aged under 5 as these pose a risk for choking. Avoid giving raw or lightly cooked shellfish, and honey shouldn't be given to babies under the age of 1 as they can contain harmful bacteria. Getting started. So this first wee part of weaning is all about a positive taste experience for your baby. It's the time when your wee one is learning about the food that they'll be eating. You want them to experience new flavours, colours and textures, and it's about them getting used to moving solid food around their mouth to be able to chew and swallow it. So when you're starting off, start with a small amount. Remember those tiny tummies. So it is as little as 2 to 3 teaspoons once a day. Choose a time of the day when you're both feeling relaxed, because your baby can pick up on the way that you're feeling. There are a lot of skills involved in having to pick up, chew and swallow their food, so don't worry if your baby doesn't quite master the technique straight away. There's absolutely no rush. Getting used to different textures often cause babies to gag. This is completely normal, as babies have a really sensitive gag reflex which keeps them safe. As they progress in their weaning journey, you should find that they will gag a lot less, because that wee gag reflex will move further back in their mouth as they get used to coping with different textures. It is important, however, never to leave your baby unattended while they're eating, just so that you can help them out, obviously, if they're running into any difficulties. Spitting food out the first couple of times is quite normal. Just wait and try another time. Sometimes it can take up to 12 to 15 times for a baby to accept a food, so please don't give up. It's important to go at your baby's pace when they're eating and let them show you when they're hungry or full. Stop when they show signs that they've had enough, and that they might do that by firmly closing their mouth or turning their head away. So don't force your baby to eat. We'll just wait until the next time if they're not interested. Giving a little water in a sippy cup is great, because it gets them used to drinking out of a cup, and it also gets them used to the taste of water. Tap water is absolutely safe to give to a baby from 6 months of age. Weaning should be fun and messy, so be relaxed and let your baby feel and play with their food. This helps them learn that food has different flavours, colours and textures, and some can be taken from a spoon while others can be held and eaten with their hands. Suitable first foods. Ideal first tastes for your baby are single vegetables or fruits that are soft or well cooked. As your baby's used to a naturally sweet taste already from their breast and infant formula milk, try going for a veg that is less sweet. Something like broccoli, cauliflower or spinach. This will help your baby get used to a range of flavours. Giving your baby finger foods will help develop biting, chewing and get them used to different textures. Babies love picking up food and feeding themselves, and this will also develop their hand-to-mouth coordination. A finger food is a food that's cut into pieces big enough for babies to hold in their fist with a little sticking out, and this should be roughly the size of an adult finger. So just a round up about what we've been chatting about today. There's no need to spend lots on fancy weaning equipment. Keep it nice and simple. Keep your baby safe by following the food safety advice. Remember, it's a gradual introduction of food into their diet, so there's absolutely no hurry. Start with a single fruit or vegetable and have this well cooked or soft. And you can give this as a finely mashed texture or as a finger food. Weaning is messy and fun, so touching and feeling food is all part of the positive experience for your baby. And spitting out food and gagging is all a completely normal part of weaning. So have fun with your baby as they get to experience different flavours and textures and learn all about eating and enjoying their food. Thank you so much for joining me today. Please take a look at some of our other videos in our Messy Muncher Weaning series.